Good morning. This is Dr. Wally Taylor from Austin, Texas, Brain Wellbeing. And as you know, I'm a physician here treating chronic complex illness. I just wanted to jump on the YouTube here for just a minute this morning to give you a couple of pieces of information I'm really excited to share that might be of benefit to you and your family. First of all, most of you know that we've been rolling out in the United States a lot of testing of late. It's one of the areas we've lagged behind, and it may have been problematic because it's important to know who has the virus, and so that we can help isolate them and prevent spread. But I wanted to tell you about a new test that is just now on the brink of being available and hopefully will soon be widely available. But the current test, which of course uses the swab, the pharyngeal swab, which means you have to put a Q-tip back in your nose to the back of your nose, looks kind of uncomfortable. The test I want to talk about is not a test for the virus or what we call a direct viral antigen test, but this is a new test that will be based off of a blood sample, and it's what we call an antibody test or an immune globulin test. You see, when a person is infected with a virus, the immune system jumps into action, particularly the lymphocytes. And one of the things that happens is a group of lymphocytes called B cells begin to make special immune proteins that are called immunoglobulins or antibodies. And once these levels of proteins build up, and they are specific for a specific virus, once they build up, they confer immunity. So when the virus comes in the body, the immunoglobulins help the body to destroy the virus so that the virus can no longer be shed to other people and it can no longer cause infection in that particular individual. So that person is protected, if you will. Well, anyway, the antibody test, what we sometimes call serologic titers for a specific infection, in this case, we're talking about the COVID-19, is now available. It was a new virus, so they had to develop this antibody test. But it's becoming available. It's currently available from several different lab manufacturers, and it's in the stages now of validation, which means they just have to test a few people that they know whether they would be negative or positive, and so that they can begin to see whether or not the antibody test is accurate. But I'm super excited about this test. This will be an amazing test for people, especially healthcare workers, that suspect that they may have already contracted the virus. You know, many times the virus can cause an asymptomatic infection or a very mild infection, which really just looks like a cold or the flu. So if these people are tested, they can find out whether they have low levels of antibodies, which would imply that they had never been infected and are still not immune, still capable of catching the virus, or if they have what we call high titers or elevated levels of immunoglobulins, which would imply that they had already contracted the virus and their immune system had already reacted, building up these antibodies and giving them immunity. So, of course, that would allow that particular individual to then circulate among other infected people, provide treatment to people with infection, even life-threatening infection, and be able to minister to those people without having any real risk of being able to contract the virus themselves, so that they wouldn't get sick and they wouldn't shed the virus to other people. So this is a super exciting piece of information, and look for that. It's probably going to be available through some of the major lab testing companies, but again, it will require a blood sample, maybe eventually a finger stick, but at least for now, a venipuncture, have to draw the blood from the vein. So that's the antibody testing for immunity, serologic titer test. The other thing I'm really wanting to share with you and excited about is, I know many of you know that one of the big problems with this viral epidemic is that the seriously ill people go into this respiratory failure, and many of them require to be on a ventilator, which provides positive air pressure ventilation through a tube that's either passed through the nose or the mouth, or in some cases, it's made through a little tracheostomy incision in the neck. And then you have to be on a ventilator to assist your breathing because the lungs are not able to breathe for themselves. Now, One of the problems is we have a real shortage of ventilators. There's been even examples of putting more than one person on one single ventilator just because we don't have enough ventilators for the patients that need them. Well, I'm excited to say I heard a report early this morning out of the UK that the Mercedes-Benz Formula One team, together with some medical scientists in the UK, are developing what we call CPAP. So that stands for continuous positive airways pressure, which is a little bit different from a ventilator. And with CPAP, you use a special mask. Many of you are probably familiar that have been diagnosed with sleep apnea and have to be on at night on CPAP or BiPAP. Well, that requires that you wear a mask that fits snugly against the face so that it creates a seal. And then the tube from the mask goes to a little device or machine called a CPAP machine or a BiPAP machine. But this is much, much simpler than a ventilator and cheaper and easier to make and easier to manage. Because in this situation, the machine puts positive pressure into your nose and mouth, and then that gets transmitted down to your windpipes and then eventually to your lungs. And what that will do is that will help open up your lungs and allow even a person who's marginal as far as being able to breathe on their own, the ability to breathe, assisted by this positive airways pressure. And of course, you can attach that to oxygen so that you can also provide positive pressure with oxygen and help the body's oxygen levels be maintained in a normal fashion. So this is going to, I think, provide a partial answer to many of these people that are not strong enough because of the infection to breathe for themselves. They're developing respiratory failure, but they don't necessarily need to be on an endotracheal tube through the nose, throat, or through the neck and on a ventilator. They can just be put on this mask and breathe with this CPAP machine. Of course, that will require some degree of monitoring as well. Some of these, though, may also be able to be used even at the home setting, so they wouldn't necessarily always, in every case, have to tie up a hospital bed or a direct nursing observations. So these are two very exciting things, one of them on the testing front and the other one on the treatment front, that may help go a long way to lower pain and suffering and the spread of the disease, and hopefully shorten the length of the epidemic and obviously the many financial outcomes that we're facing as a result of having the global economy being shut down. So I hope this has been helpful to you. And again, stay safe, maintain your social distancing. Don't get out any more than you have to. This is a time to stay to yourselves, unless, of course, eventually you can find out that you're immune through one of these tests that we talked about. So God bless everyone. Have a great day. And I hope to bring you some more information. If you like this video, please share it with family and friends. Please follow us on the Brain Wellbeing YouTube channel. And please also follow us on the Brain Wellbeing Facebook page and Instagram. And as soon as we can, we're going to bring you back to the microcurrent neurofeedback that we offer at Brain Wellbeing, which is a really exciting way to help you with the stress and the fear and anxiety and panic associated with this uncertainty that's going on in our daily lives. Okay, talk to you soon. Bye-bye.